Councillor Rigby.
Thank you, Madam Chair. If I can have that motion put up, I appreciate it. Whereas it is prudent and necessary for Niagara Regional Council to remain regularly apprised of the status of the need to continue with the mandatory face covering bylaw, and whereas it is our desire as a region to effectively learn how to live with the COVID-19 virus safely. Now therefore be resolved that the region of Niagara Public Health Department provide an information report at each Public Health and Social Service Committee meeting, providing data that would demonstrate if Niagara Region should or should not continue the enactment of the mandatory face covering bylaw 2020-46, and that the report include evidence from provincial, federal, and international health agencies. And if I may speak just very quickly to this, Madam Chair, we passed a motion at our last council meeting that extended the bylaw to April 1st. And that in itself I had no problem with, except that we were not indicating that we would continue to review it on a monthly basis, which I thought was necessary. And therefore, I brought this thing forward. I personally don't have an issue with the bylaw itself, but I do think we need to indicate to the public that we're prepared on a monthly basis, that we will look at it, and with the best evidence that our staff can find, as to come to the conclusion as whether we should continue or not. Now, earlier today, we heard Dr. Urge talking about, well, it's a provincial legislation. Yes, it is, but it is our bylaw. And if that were to be changed over the next 2 or 3 months, for whatever reason, we would still have a bylaw unless we have the information and go ahead and make a change, either for hopefully a reduction, but certainly as we go forward. I think, frankly, we need to be a little bit more positive in our approach, and I don't blame anyone for having to be in the reactive mode that we've been in since this disease started. But we need to make our best effort and to find ways that we can go forward and live with this disease and live comfortably. So we don't know, frankly, how people are being affected in the long run because of having to restrict what we're doing. Thankfully, our school children are back at school, and they're doing relatively well. There are issues, but a lot of other children have lost out over the past 6 months, and particularly young children, because they lost their social activity, whether they're 3 or whether they're 18, they were losing that, but they're also losing their opportunities if they had to look forward to being an artist or being a musician or being an athlete, and it's a bit of a struggle for any of them to get back on stream. So we need to be active in considering them as well. So I brought forward this motion because I thought it's necessary for this council, for this committee, and then our council to know that we're looking at everything and we're trying to make some decisions that will be effective in the future. Thank you, Madam Chair.
Thank you, Councillor Rigby. Dr. Hergy, did you want to speak to this, please?
Okay, thanks, Madam Chair. I certainly respect what the councillor is attempting to do here. I do want to flag, though, that providing a report every month is going to generate a lot of additional work for public health. And right now in public health, we are more than maxed out in our capacity. We have staff staying to very late every night doing work to respond to COVID-19, amassing large amounts of overtime. And so I feel this would be an additional stressor that would be very difficult for us to manage at this time. I'm also worried that, of course, this is now the fourth meeting, I think, where we've discussed the face covering bylaw. And if this comes back every meeting, we are likely to see a bunch of delegations come every meeting and continue to have this discussion. And as was pointed out earlier in the meeting, right now with a provincial regulation requiring face covering, it's somewhat moot whether or not we make a decision around this. I would suggest that perhaps we could bring forward any new evidence that comes that drastically changes the landscape and mention it in the regular update we're doing every meeting around COVID-19, and that way councillors would be appraised of any new evidence that comes up. And of course, at the 6-month point where it's coming due, if councillors want a update on where things stand, we can certainly provide it at that point where there's that decision to be made. But doing this every month, I think, would be quite a burden on us at this point. And so I'd ask that we not add that burden onto us right now. The other thing I just want to note here quickly is that I don't think this is ultimately a question of what the evidence shows. I think, the evidence was laid out for council back in June. It's not extremely strong one way or the other, though certainly leans in favor of face coverings. This was really a judgment call of what does the public want as represented through council in terms of how much are they willing to alter lives versus how much do they want to make sure that they're taking those incremental efforts to protect against COVID-19. And I think council landed on where they think that balance should be. And I don't think that balance is really going to shift based on evidence. I think that's really more of a values question that council is at to answer. So I would leave it there, Madam Chair, and I think I'd ask council to think carefully about how much additional work they want to put on public health when we're already trying to make sure we're doing the work to stop the spread of COVID-19.
Yes, anything further, Councillor Rigby?
Thank you, and I certainly respect Councillor Hergé's comments, and I certainly understood that this was going to be an additional hardship on our committee. And the COVID report that we receive monthly for each one of our departments is fairly lengthy in the description, but certainly could be used with additional items as the doctor's offering. And the problem, I hate to go back to that motion discussion, but we had about 7 or 8 members of public do presentations, and they were providing data and information from people I don't know, but we didn't know, and we didn't even ask Dr. Hergé whether what they were presenting was actually factual. I would like to think our citizens are always factual, but we didn't ask that. So I think those are the kinds of things that if in doing some additional work, they can provide, as Dr. Hergé's suggested, is if there's something new that's coming in, then we'll put it in. That's good, but just make it separate. I keep looking at Dr. Hergé. Sorry, because I'm at the council meeting. So, thank you, Madam Chair.
Rigby. Chair Bradley.
Thank you very much. I understand what Councillor Rigby is endeavoring to do in having that information. However, I think the information provided by our acting medical officer of health has provided us with some additional information. What I would presume is that if there's any change that's necessary or advocated by staff, that staff would take the initiative to come before either the committee of council or council to advocate for a change in this particular issue, rather than having it come back each month where out come both sides again that we've heard from time and again saying why yes or why no. So I am optimistic that should there be any change of view from healthcare staff in the region, they would, as I think Councillor Rigby would like them to do, come back to share that change in advice or change in information. I just think that every month is going to be problematic for the reasons that Dr. Hergy has suggested. Also, though it is provincial, the province has brought in a province-wide bylaw. Now, I thought if there were going to be any changes that people would be advocating, they would have been the ones that people have been asking, I think, St. Catharines City Council for, and that would be in apartment, common areas and apartment buildings and condominiums where there's been a request. But if there's any change that would be advocated, I think our public health staff would be prepared to come forward to offer it at the appropriate time. But as I say, I recognize fully that Councillor Rigby has never said that he's opposed to the mandatory mask bylaw. He's never said that. And so I think to characterize that as some have as his opposition will be inappropriate. He has been in favor. I think what he's trying to get, the information he's trying to get can be provided, just not in the timetable that is included in this motion.
Councillor Foster?
Yes, thank you, Chair Greenwood, and just to echo the regional chair's comments on that, we are all on a daily basis monitoring what it is that's going on. If this isn't top of mind to every one of us who is on this regional council, I would suggest that there's something wrong with the regional councillor. I mean, let's face it, guys. We're watching what it is that's going on, and I, for one, want to remove these bylaws and everything else as absolutely fast as we can. But we know that that isn't possible. We know the province is going to tell us when these things are appropriate. We know that the federal government are the things that are going to be coming into play. So, you know, to put extra work on top of our staff, I think, given the fact that they are so busy, I think is a bit on the ludicrous side. So anyway, thank you.
Thank you, Councillor Foster. Seeing no other speakers on the list. Councillor Villela.
Oh, thank you. Through you, Madam Chair. All this reference to the province all of a sudden. So the province has now mandated it, and that's great. That's probably how it should have been from the very beginning. But that being said, here's my question to Dr. Hergy and to whoever else may want to answer it. So if the province decides that they're no longer mandatory, does that mean we get rid of our bylaw? Fair question.
Dr. Hergy.
So, Madam Chair, if council gets rid, if the province gets rid of their regulation, once again, the regional bylaw would be governing, assuming we haven't reached a sunset date, and it would be a decision for council whether or not they wish to keep the bylaw or not.
Thank you, Dr. Hergy. Thank you.
Thank you, Councillor Villela. Seeing no other speakers on the list, I'll call the question. Take the vote. The motion is defeated.